This morning we have a special treat. Our conference is called Give Peace a Chance, Community Consciousness, Inner Wisdom, and Social Change. Our speaker this morning is going to address the issue of inner wisdom. His name is Paul Epstein. He is a naturopath, a yoga and meditation teacher, and currently lives in Westport, Connecticut. He has a practice in Westport and also in New York City. Paul travels all over the country lecturing on the work he does, which integrates medicine, meditation, therapy, and yoga to create a unique style of healing that is his alone. It addresses our bodies, our hearts, and our souls. And I feel this is highly appropriate for our conference. So I'd like you to welcome Dr. Paul Epstein.
Good morning. After 3 days of psychodrama, I'm not sure I'm the person that she just spoke about. So I've been with many of you in different aspects of the journey, and I think it's appropriate in thinking of what I would say to be of service to tell you my story, and who better to tell a story to than to psychodrama people. So I'm going to tell you my story through living questions that I ask and that guide me in my work as a doctor and teacher and speaker, and share with you stories from people who've taught me, mostly my patients and teachers and students, and share with you some principles of healing that I've come to understand and guide me, and I share them in a sense of contemplation, inquiry, and exploration for your own inner journeys and your own paths to understanding who we are and what we're doing here and how we help people and how we help ourselves deal with pain and suffering. So to begin my journey of healing, on a professional level, it began when I studied Montessori teaching. And what I learned there was that learning is natural. And if you want a child to learn, you simply create an environment for learning to happen, and that's the Montessori method. And you treat each child individually. How that relates to medicine and healing is, to me, healing is natural, and if I want to help people in their healing journey, it's to help them find the healer within and guide them to create an environment in their life, in their mind, in their body, in their heart, in their soul, which allows healing to happen naturally. I continued my journey personally, professionally, as a yoga teacher. And what I learned there, I did that in the 70s. And what I saw were people in those days, there weren't holistic doctors, there wasn't alternative medicine or natural healing to the degree that it's become popular or integrated in the culture today. And people came to my yoga classes in New York City in the 70s, and sometimes they had arthritis or allergies or asthma or worse in terms of their diseases and suffering, for which conventional care didn't have an answer and for which there wasn't much in the way of alternative treatment. And I watched people heal themselves. I wasn't treating them, I wasn't prescribing, I was a yoga teacher. I was teaching them how to stretch and do asanas, how to breathe, how to meditate, how to look at the world a little differently, and how to see things in a new way, and then how to view their illness as a vehicle, as the opportunity, as the teacher, that as they worked with it, it helped them grow personally, professionally in their healing journey and in their spiritual journey. And something about that really excited me. I was still in the formative stages of who am I and what do I want to do with my life, and I decided I wanted to be a doctor. And I went back to school for pre-med. I had been in pre-med in the 60s, but unfortunately I went to school at Stony Brook during the turbulent years of Nixon and the Vietnam War, and sadly, or not so sadly, I spent most of my time with drugs, sex, rock and roll, and protesting. and ended up not doing very much of studying organic chemistry until a little later in life. Anyway, when I went back to school to be a physician, I went on a medical school interview, and they asked me why you want to be a doctor, and I said, well, I'm interested in healing and the mind and consciousness and nutrition and helping people heal themselves and take responsibility. And I had a panel of 5 people, and they really looked at me like, what planet is this guy from, unfortunately, in those days? And I realized this isn't the kind of doctor I wanted to be. So I became a naturopathic doctor. I saw an ad in the Sun magazine, and it said, become a different kind of doctor. And so as a naturopath, I share this so you can understand the context of my remarks. We're trained as general practitioners. We go through pre-med. Our first 2 years are like conventional medical school, except our therapeutics is to use natural therapeutics instead of drugs and surgery as a vehicle for treatment. Nutrition, herbs, homeopathy, acupuncture, Chinese medicine, physical medicine, and counseling. And I'm here at the Psychodrama conference because my area of focus and specialty is mind-body medicine and the mind-body connection. But from my context of teaching in Montessori and from the sense of being a yoga teacher, I wasn't interested in treating people. I wasn't interested in finding out what was wrong and him telling me their diagnosis and then prescribing and treating. I was interested in guiding them and helping them find the place inside of them that would help them take responsibility, sort of own their disease and participate in their healing journey. And as much as I learned at naturopathic school, it wasn't teaching me to do that, so I continued that quest for myself of how do I contact that place in the person where the healing really resides. And that was one of the first questions that I started asking when the patient came in. I knew what herb to give them, I knew what vitamin to give them, I knew how to adjust, and I knew what to prescribe, but I didn't know where the healing was in them. And I began that journey, and that's what I want to speak about, that quest in my work to live those questions for myself and my clients, as well as supporting people to kind of go deeper. So the first patient that I want to share with you was a person who came with high blood pressure and diabetes. And again, in the context of time, since we started late and I've been shortened a bit, I will be rushing through some of the remarks that I had prepared. But long story short, I worked with him for about 6 months. We changed his diet and we gave him vitamins and herbs, and his blood pressure came down and his diabetes was under control and his digestion went fine. And I said, whoa, I'm a doctor. I was doing this as a resident at the school. And unfortunately, a year later, he came back in the same condition as when he left. And I had to ask myself a question. What did I miss? I'm still becoming a doctor. I'm still asking those questions. I still try to understand what's happening for people. And what I missed was I didn't ask, how did you come to be this way? I didn't really try to find out his story. I didn't really try to treat the person as well as the disease, even though we had said that as principles. But doing it, being with it, instead of having the answer was a real challenge. How do I treat the whole person, not just the part? How do I engage them in their journey and not be a doctor who prescribes? That's the art of medicine. That's the art of healing, where the healer really is the patient and getting them inside. But people don't come for that. They come for, you have the answer, here's what's wrong, do it to me or for me. And when I started to ask that question, well, how did you come to be this way? And that's the question I'm answering for you, and I decided to make the topic of the talk, how did I come to be this way? That I'm speaking here to you about healing in this way. I started to find out people were telling me their stories, and there started to be a connection. This is now to speak about the mind-body connection, and to speak about how biography becomes biology, that they didn't just end up in a doctor's office with disease X, Y, and Z, absent what's going on in their life, absent stress, absent their childhood, absent their karma, absent their ancestors, absent their genetic integration. And then that became the biggest question. Now, people didn't come to me for that because I was a doctor. I wasn't a therapist. But holistically speaking, I'm there to help people get well with what they need. So I started to need tools to access the truth and to start to listen to what was happening. I needed to learn how to listen and understand. So I started studying guided imagery as a tool. And I was thinking in terms of my context for psychodrama, pretty much the work I do is internal psychodrama with patients, because I don't work with groups, but all of the parts